Alright, so we're going to talk about special tests that PTAs usually see. So the first one we're going to talk about is biceps tendon pathologies. The first test is Speed's test, and in this test, the patient is positioned in sitting or standing with the elbow extended and the forearm supinated. The therapist places one hand over the bicipital groove and the other hand on the volar or anterior surface of the forearm. The therapist resists active shoulder flexion. This test is positive if there is pain or tenderness in the bicipital groove. The next test is Yergason's test. The patient is positioned and sitting with 90 degrees of elbow flexion and the forearm pronated. The humerus is stabilized against the patient's thorax. The therapist places one hand on the patient's forearm and the other hand over the bicipital groove. The patient is directed to actively supinate and laterally rotate against resistance. This test is positive if there is pain or tenderness in the bicipital groove. Next, we're going to talk about rotator cuff pathologies and impingement. The first one we're going to talk about is the drop arm test. The patient is positioned in sitting or standing with the arm in 90 degrees of abduction. The patient has to slowly lower the arm to the side. This test is positive if the patient fails to slowly lower the arm to their side or if there may be severe pain. Another test is near impingement test. So the patient is positioned in sitting or standing. The therapist positions one hand on the posterior aspect of the patient's scapula, and the other hand is stabilizing the elbow. The therapist elevates the patient's arm through flexion. This test is positive if there is a facial grimace or pain in the shoulder. So the Ruse test, this is for thoracic outlet syndrome. The patient is positioned in sitting or standing with the arms positioned in 90 degrees of abduction, lateral rotation, and elbow flexion. The patient is asked to open and close their hands for 3 minutes. This test is positive if there is an inability to maintain the test position, a weakness of the arms, sensory loss, or ischemic pain. So a test for neurological dysfunction is the Phelan's test. And in this test, the patient is positioned in sitting or standing. The therapist flexes the patient's wrist maximally and asks the patient to hold the position for 30 seconds. So both wrists are flexed and they're up against one another, so it's almost like a reverse prayer position you're making with your hands. And this test, they're asking to hold the position for 60 seconds. This test is positive if there's tingling in the thumb, index finger, middle finger, and lateral half of the ring finger, meaning the median nerve is impinged. So we also have the Finkelstein test. This patient is positioned in sitting or standing and is asked to make a fist with the thumb tucked inside their fingers. The therapist stabilizes the patient's forearm and ulnarly deviates the wrist. This test is positive if there's pain over the abductor pollicis longus and extensor pollicis brevis tendons at the wrist, which may be indicative of tenosynovitis in the thumb or D. Curvain's disease. Now remember, anything that has the word pollicis in it refers to the thumb. All right, now we move on to the hip. For contracture or tightness, we have Eli's test. And in this test, the patient is positioned in prone while the therapist passively flexes the patient's knee. This test is positive by spontaneous hip flexion occurring simultaneously with knee flexion. And it really indicates a tight rectus femoris. We also have the Ober test. So this patient is positioned in side lying with the lower leg flexed at the hip and the knee for stability. The therapist moves the test leg into hip extension and abduction, and then attempts to slowly lower the test leg. This test is positive if there's an inability of the test leg to adduct and touch the table, and it's usually indicative of TFL tightness. So we also have the Thomas test. In this test, the patient is positioned in supine with the legs fully extended. The patient is asked to bring one of their knees to the chest in order to flatten the lumbar spine. The therapist observes the position of the contralateral hip while the patient holds the flexed hip. So positive testing is indicated by the straight leg rising from the table and is indicative of hip flexion contractures. And usually it's more iliopsoas involvement when the knee is extended, and rectus femoris involvement when the knee is flexed. All right, so we also have for the knee, we have the anterior drawer test for ligamentous instability. For this test, the patient is positioned in supine with the knee flexed to 90 degrees and the hip flexed to 45 degrees, so basically hook lying. The therapist stabilizes the lower leg by sitting on the forefoot, and they grasp the patient's proximal tibia with two hands, places their thumbs on the tibial plateau, and administers an anterior directed force to the tibia on the femur. A positive test is indicated by excessive anterior translation of the tibia on the femur with diminished or absent endpoint, meaning that because of the ligamentous lacking, you're going to be able to pull it forward when you really shouldn't. Okay, next we also have Lachman test. And in this test, the patient is positioned in supine with the knee flexed to 20 to 30 degrees. The therapist stabilizes the distal femur with one hand and places the other hand on the proximal tibia. The therapist applies an anterior directed force to the tibia on the femur. A positive test is indicated by excessive anterior translation of the tibia on the femur with a diminished or absent endpoint, and this is indicative of an ACL injury. All right, we also have McMurray test, and this is testing for meniscal pathology. And what that means is, so the patient is positioned in supine. The therapist is going to grasp the distal leg with one hand and palpate the knee joint with the other, with the knee fully flexed. The therapist is going to immediately rotate the tibia and extend the knee. The therapist repeats the same procedure while laterally rotating the tibia. A positive test is indicated by a click or pronounced crepitation over the joint line, and this is usually indicative of a posterior meniscal lesion. So next we have the Thompson test. So this is a test where the patient is positioned in prone with the feet extended over the edge of a table. The therapist asks the patient to relax and proceeds to squeeze the muscle belly of the gastrocnemius and soleus muscles. This is positive if there's an absence of plantar flexion, which might be indicative of a completely ruptured Achilles tendon. And that's it. See, that's not too many to learn. You guys can do it.